That was the last time the world heard the king of pop perform his iconic hits, which took place on the 24th of June 2009. The next morning, tragedy was announced. The world, shocked, saddened, hurt, knowing our very own moonwalker has passed only in the beginning of his 50s. Autopsy confirmed that he died from an overdose of propofol and benzodiazepine intoxication, which was administered by Dr. Conrad Murray, his very own physician. Dr. Murray was found guilty of involuntary manslaughter in 2011. Many believe it was just an accidental overdose on Michael's part, and some even think Michael didn't want to live anymore.
I don't even care about my life anymore. I just want my children to be okay. My angels.
Due to his deterioration of mental health, because sometimes Michael talked like he was going to die. But is that really the case? Or was Michael Jackson murdered by his own physician? But how? The very first eye-opener is when Dr. Murray admitted to administering propofol to Michael. The drug was administered to Michael as a sleep aid. Michael struggled with insomnia. However, the use of propofol for treating insomnia is highly unusual and not approved. Such use is deemed fatal. Propofol is a potent anesthetic agent, typically used in hospitals or clinical settings for procedures requiring sedation or general anesthesia. No personal doctor should ever be handing out propofol, which is an anesthetic, to treat mental health issues. Let's remember that. This next point may shock you. Michael Jackson was found unresponsive and not breathing in his home. During the time of this scenario, Dr. Conrad Murray was present. The logical thing to do is probably call 911 ASAP. But Dr. Murray took 20 minutes to call 911. Yeah, 20 minutes. During the trial, prosecutors argued that the delay in calling 911 was a crucial factor that could have impacted Michael Jackson's chances of survival. But Dr. Murray argued that the reason for the delay was he was trying to revive Michael with medication. I want you to take a quick guess on what medication he used. What could it be? Yep, more propofol. You heard it right. Dr. Conrad Murray attempted to revive Michael with more propofol. Dr. Murray also mentioned in an attempt to resuscitate Michael, he attempted CPR, but it was found that the doctor paused the CPR to administer the medication. A person laying down not breathing obviously needs oxygen. The decision to pause the CPR became a point of contention during the legal proceedings, as CPR is a critical life-saving intervention. Any interruption could impact the chances of survival. So did Dr. Murray really stop giving CPR so he could administer the medication? Or did he stop because he knew his patient needed oxygen? Some kind of ill will? An expert medical doctor testified that Michael most likely died because his tongue blocked the back of his throat. The expert also said Michael could have been saved if Dr. Murray lifted up Michael's chin. The chin lift is a standard technique used to open up the airway. This involves tilting the head back and lifting the chin to ensure a clear passage for air to enter the lungs. Michael Jackson's death was eventually ruled a homicide, and his death could have easily been prevented. This case has taught us a lot about trusting prescription drugs and physicians. Make sure you do your own research before consuming any medication. Double check with another doctor, and always take care of your physical and mental health. If you like the video, comment what you think and subscribe to help keep our channel growing.